Hey, everybody, welcome to this month's edition of Advise's LinkedIn Live. I'm super excited to have Gene Stone on this month. Now, Gene has been on before, back when we first started doing these a couple of years ago. And for those of you that know Gene Stone, Gene is very well known in this space. And for those of you that don't know Gene Stone, shame on you for not knowing Gene. Well, if you're from the New York City area, you know Gene. And Gene, I always say that I had two mentors when I was an OIG agent. I had Jason Eisengrein, who's here at Advise as one of our directors, taught me all the things about being an OIG agent, and I had Gene Stone teaching me all the things about Medicare. Gene spent 46 years at the precursor to CMS when it was HCFA, Healthcare Financing Administration, and then went on when it was CMS and worked in ultimately what was known as CPI, Center for Program Integrity, although there was a little bit of a bump when it was known as the Program Integrity Group, which nobody liked that acronym, the PIG. We try to forget that. So, but Gene in retirement, for those of you that know, Gene probably has testified more than anybody else in the country that I'm aware of for the government on healthcare fraud, waste, abuse issues, is a wealth of knowledge in the healthcare payment integrity space. And in retirement, outside of her always having a lot of hobbies, and her biggest one is, for those of you that don't know it, she is known in the New York City fashion circles. You've been in so many magazines. It's great to keep up and see those things on Instagram. But in retirement, Gene has spent a lot of time with the Senior Medicare Patrol, or what's known as the SMP, which is an amazing and fascinating organization that is funded by the government. And so we want to talk a lot about the SMP. I want to talk a lot about the statistics and things of that sort. So Gene, I want to, before we even get to some of those statistics and all of that, let's talk about what drove you to the Senior Medicare Patrol kind of in the beginning.
Hi. So as you alluded to, I did work for the federal government, and Senior Medicare Patrol and the state health insurance program in New York State are both funded through HHS, from the Administration for Community Living. Okay, and ACL works with hand in glove with CMS, and we have SMP, Senior Medicare Patrol, and SHIP types of programs in every state and territory: Puerto Rico, Virgin Islands, Guam. So whatever state a senior is in, they have access to information on just what Medicare is, Medicaid, what the options are every year during annual enrollment, any changes in programs from the prior year. And then they also have Senior Medicare Patrol, where they can get educated about the latest scams, how to protect their Medicare cards, their identity, and then what to do if they are the victims of identity theft. Seniors many are very, very savvy and very technologically adept, and others are not. So Senior Medicare Patrol focuses on educating the seniors, their caregivers, and their family members, because oftentimes family members are the ones that get involved sometimes in situations after the fact, after the individual has been victimized. It was great because there was one time when, in fact, someone used my number when I went to get my flu vaccine. and I needed to have proof of it so I could go to Project Runway's final session, final viewing. So not only did they, when the bill came in, not only did they bill for the vaccination, they also billed for a $200 consultation with a physician. Now, the testing was the nasal swab that took place in a storefront with nothing in it but 2 chairs and the laptop of the person who was doing the test with the big long Q-tip. So there was no physician there to perform any kind of testing. So it was great because I could just go through channels, and report the potential fraud. So a large overpayment resulted from that situation. So I digress. Let me talk a little bit about what our members do. We go out into the community, into pharmacies, nursing homes, and we do outreach and education in all types of public housing, with invitation. I did a presentation recently at Richmond Medical Center in Staten Island during open season to help educate our volunteers to get the word out for changes in co-pays, how much is out of pocket, any changes in what prescription drugs are covered or what their reimbursements are, and any new services that have been added since the past year. It's really interesting whenever our agency and CMS announces open season, I have this mental image of seniors with a big bullseye target on their back.
Right.
Because when the plans start putting out word, you see advertisements on TV, you will also get inundated with seniors and family members get inundated with email and other advertisements from these entities that are going to help you decide which plan to get. And so there are ways of doing that without getting any personal information from the patients. But unfortunately, there are ways that when the patients get into the discussion, the person doing the interview can get who all the doctors are that right. Patient sees. And that information then can be used to order medical equipment, durable medical equipment the patient doesn't need from a doctor they've never met, never seen, or prescription drugs are billed as ordered by that doctor for diagnoses that patient doesn't have. Right. So it is truly open season.
Yeah, I mean that what we're really talking about is social engineering to get people to give information that they likely wouldn't have probably normally given. And I think generally we see very large upticks in that during open enrollment, and then January, February, we see a ton of complaints and a ton of fraud because of open season. And what you're really talking about are these advertisements where it really is nothing more than a licensed insurance broker who is licensed to sell products in the Medicare Advantage space for multiple different payers. And they are essentially doing a service that ultimately results in them receiving a commission. But the thing that I think is fascinating to me is, so just looking at some stats in 2023, the Senior Medicare Patrol nationally conducted outreach to over 1.2 million seniors and over 22,000 events across the country. And the piece of this that's fascinating to me is when we go back and we talk about open enrollment and we talk about the fact that these brokers are out there and the calls and called this 800 number. The fact is that the Senior Medicare Patrol does essentially the exact same thing as a one-on-one service with seniors. And I was just telling you, like, one of the things that I've always found interesting is the fact that during open enrollment, you can walk into your local large pharmacy, and in the front entrance of the pharmacy, there may be Senior Medicare Patrol representatives there helping seniors navigate in that space. And so all of these telephone calls and all these television commercials and all of that stuff that's out there is actually done to a large extent by the Senior Medicare Patrol in a safe, effective, professional environment. And it's really peer-to-peer because many of the people that are, in fact, volunteers like yourself are Medicare beneficiaries as well.
Exactly. And, when I'm off duty and I'm out with my girlfriends, one or two of them will pull me aside and ask me some basic questions, about them, about their own individual plans. And, the doctor that they know and love has retired or has left that particular plan. What are their options? So, and if my friends have those questions, I know that a lot more people out there have those same kinds of situations. So it really is an amazing phenomenon that CMS and ACL have been able to secure funding to train the volunteers. And, we have a whole separate email situation where we're getting updates on any changes. We get updates on scams. There are newsletters put out in each Senior Medicare Patrol state or territory. And then there's a national SMP newsletter that comes out every month. So we recommend that any contractors who process claims, deal with outreach or education, or program integrity types of issues, get on their mailing lists, because they'll also tip off what the latest scams are, what the changes are in legislation, changes in personnel at their local state agencies. So, and especially right now, because we are going to be in a transition period, going to a new administration, and some of the names of our contacts are going to change. Some of the agencies will change. Some of the titles will change. So we're going to be in a slight transition. And it'll be interesting because during open season, all of the changes or updates that were done in individual Medicare beneficiaries' records will be effective January 1. So there may be a change the next time a senior goes, next month when they go to see their doctor or their laboratory to get, or they go to the pharmacy to get a new vaccine or an update or get a new prescription. So that's when our hotlines, phones start to buzz, and that's where our Medicare contractors' phones start to buzz too.
Well, and the thing that's interesting is in the SIU space, particularly, whether it be on the commercial side, Medicaid or Medicare Advantage, whatever it may be, is there's always this interest in learning about what is the new fraud scheme out there, what's the latest and greatest. And what you just described is actually a great intelligence source. We do a weekly OIG roundtable, right? Matt Kachansky and Wade McFall, who I know you also know for a very long time. And we talk a lot about the importance of intelligence gathering in the healthcare fraud space to learn these things. And what you just brought up was a very important piece of that. It's being able to have the Senior Medicare Patrol disseminate what they're hearing from outreach, from phone calls, from things of that sort. And, the story I always love to tell, I had some great experiences as an OIG agent with the Senior Medicare Patrol in New Jersey. And, I had a great successful case involving an individual named Seth Reefus who had set up a sham not-for-profit and was going into senior buildings and ultimately was really doing nothing more than touting genetic testing and paying kickbacks to people around the country for the swabs. And he was setting up shop in the community rooms of buildings and what have you. And it was one of the first, if not the first, genetic testing fraud case in the country in 2015. And it was really kind of a boots on the ground approach versus the telefraud schemes. But Senior Medicare Patrol played a really integral part in that because they had been receiving dozens and dozens, if not hundreds, of complaints from around the state and was kind of collating them together. And so they were actually performing an intelligence gathering operation on what Mr. Reefus was doing around the state. And by the time I got to meet with the Senior Medicare Patrol people in New Jersey, they had already made contact with the social workers, the community development people of buildings around the state, had the names of people, had, an unbelievable level of information that you can only get from having worked kind of internally. And the Senior Medicare Patrol, I think, is a great source. And then you throw in someone like you who has 46 years now plus in the fraud, waste, abuse, compliance space, where you're looking at these things from a very different eye. And so you're really there to be able to, the level of education that you can provide to these individual Medicare beneficiaries, to the Senior Medicare Patrol volunteers like yourself, is kind of a really whole separate part of that intelligence gathering. So with that in mind as a backdrop, how did you really get yourself? And first of all, most of the people that are at Senior Medicare Patrol are volunteers, right? They do have a budget, but it's not a budget where there's millions and millions and tens of millions of government pork going into this. It's very lean. It really only covers some essential costs for administrative people and things of that sort. I know that in New Jersey, they're using space that's donated to them, for example. But the backbone of Senior Medicare Patrol uh, staffing are volunteers like yourself.
Exactly. Administration for Community Living provides the staffing for the director, the executive director, the people who train volunteers, hold our monthly conference calls, updating everybody, publishing the newsletters on the latest scams, or where the next local meetings are, updates in any kind of changes in coding, or the latest scams. And we've always done local outreach, and you hear all of the grandma scams, where, especially during spring break or something, the grandson would supposedly be incarcerated in Mexico, and someone was calling on that son or grandson's behalf to
Yep.
get bail. Well, AI has come into the picture, and it's artificial intelligence has now become generative, where they can actually, if they have got the grandson's voice on social media, the voice on the phone call is the voice of the grandson. So life as we know it in the fraud arena is about to change drastically. It is already
Right.
undergoing. And
Well, and the important piece of that is that that's a thing where seniors who are not tech savvy or who are not inclined to understand what AI, artificial intelligence is, and that's really where the Senior Medicare Patrol and people like you doing that outreach can really help, because it's, think about, well, if your grandson was really on vacation or your granddaughter is really on vacation in Mexico, would you know that? And if you didn't know it, what's the first thing that you should be doing if you got that phone call? Maybe calling up your son or your daughter to confirm some other pieces of the puzzle that seniors may not think about because there's a knee-jerk reaction to wanting to help a loved one or a family member. So being on the front lines of being able to understand what the latest and greatest are really do go a long way with outreach.
And what's really most concerning about all of this is that it is the grandson's voice on the phone. They're able to mimic it so that you don't have to call a grandson on a separate line. And, that's one of the real disturbing pieces of this, shall we say. But the advice that we have always given our seniors is to, keep in touch with the family members, especially those that do travel, but have a safe password, a safe word, so that, when you're calling, your granddaughter or grandson calls, it's like, what's the emergency number, word that you say, apple pie, I really need some apple pie, grandma. You have some kind of a password between the two of you, so that you can really verify the identity of that person on the other end of
Right.
the line.
It's kind of a sad, unfortunately, it's a sad state of affairs, and we've gotten to the point where when you try to talk to a loved one, you have to have a keyword to know whether or not this is really the person or not the person. But that it becomes an important piece of where that education comes in. So, in 2023, Senior Medicare Patrol was responsible for about $111 million in monies recovered back to the program from complaints filed and things of that sort, gone back through the MAC, through the UPIC referrals to OIG, things of that sort. Talk a little bit about when you do go to conduct outreach and you're doing it in not a reactive way, right? Where in a reactive way, people are going to you and saying, hey, Gene, can the SMP please come here? Where are some of your targeted proactive audiences for outreach? And understand, Gene, you're a New Yorker. There are more places that you could go in a year than you could go. So that's not really the issue, but it's finding that right audience for the things that you want to be able to share.
Well, our Senior Medicare Patrol in New York has regional. We've got a group near Buffalo. We've got a group, the Northeast, the Northwest, the Southeast parts of the state. We've got a group in, Brooklyn, Staten Island, Manhattan, Queens. So we're covering the geographic area. So we've got local people who are connected with local churches. A lot of the food distribution sites are really good for distributing information to seniors. The housing, lots of low income and senior housing. I live in the East Village, and I am always out there at events and things, where we've got local volunteers to give out that kind of information. Then also say, if you have questions, here's the number to call. And we've got the SHIP number for just like changes in coverage, but then, okay, your coverage changed, you went to the doctor and suddenly you've got an $800 copay. And you used to go to that same doctor last year for $10 as your copay. So, it's kind of helping them get through to see, is this legitimate? And it's just a change. The doctor's practice was bought up by, NYU or Columbia Presbyterian, and now they're also charging the charge in addition to the office visit, or is it something else, shall we say? So we tend to stay in great touch with law enforcement, CMS, ACL, and our partner, Senior Medicare Patrol. I wanted to do a shout out to Charles Clarkson in New Jersey, who has been the head of their Senior Medicare Patrol. He was around when you were there in 2015 with your case.
He was.
And so, he's just been, and that continuity is terrific because
he was.
Well, where to go. He always has the answer. And if he doesn't have it himself, he knows exactly who to call. So we do a lot of, pre-COVID, there was a lot more person-to-person interaction in senior centers and things because they were opened to members of the public and their families and caregivers, churches, senior centers, all kinds of places. And after COVID, that all shut down and things went much more online. So in those households where seniors or family members are tech savvy, it all has continued, but in those areas where seniors don't have access to Wi-Fi or, getting to the public library to use their equipment, when it's foul weather or the buses are held up with problems, or the subway system's not working, or they've changed the schedules. Interferes with just the basics of getting by, and if you're also in a food desert, the healthcare needs are competing with just food needs. Right.
I will say, you are right about Charles Clarkson. I worked with him on that case involving Mr. Refus. But the one thing I will say is I've always found that the SMP people really know the landscape of the program. They understand coverage issues. They understand the nuts and bolts. And that really does come from that continuity that's out there and that exists. Tell me, as we kind of get ready to wrap up here, you're out there. I don't know if you sleep because you're on the SMP stuff constantly, and then outside of the million hobbies that you have. But so tell me, in 2025, what are some of your predictions based upon what you have seen trending this past year in the fraud, waste, abuse space? What are some of the hot button areas that you're going to see in 2025 based upon what you're seeing now from SMP work you're doing?
The same types of fraud just continue. Durable medical equipment fraud is, knee braces, back braces, the things that we have been issuing and OIG has been, helping Department of Justice prosecute. Our contractors are collecting overpayments. So it's those kinds of things. Obviously, all of the inhalable asthma medications, especially those that use the machines to help get the aerosols into the lungs. They get delivered to people's houses who no longer use them, only need to use them, once in a lifetime. But they're out there and they're getting their prescriptions refilled. The actual liquid medications just keep coming in boxes. And the pharmacies will never take them back because once they have been, distributed, they theoretically could be tainted. So,
Right.
Kind of stuff. Ambulance fraud, billing for non-emergency ambulance trips, billing the emergency levels and the highest levels of services when it was only, a transport home from a facility where the patient is stable enough to be discharged to a home or a nursing home. So it's like, the Medicare fraud areas are they just are the gifts that keep on giving. It's the exact same kinds of things. Hospice patients who are enrolled in a hospice, which is a very specific type of service for people who have a condition that, if it ran its normal course, would be terminal within a 6-month period, meaning it's a fatal situation. And when you have patients who are in that kind of a provider network and they're living 5-10 years longer than, and they're not the exception, there's something going on. Okay. There's something fishy. And so data analysis is always, one of the ways to get at, where are the changes in reimbursement? What are the new codes that are suddenly popping that have been around for a while and nobody was billing? Was there a coverage change where now this service, once you identify a problem, you can actually treat it? It's not like, okay, you do have, this hearing problem, but Medicare won't pay for that because we only pay for, certain things, or, dental situations. It's like there are a lot of the Medicare Advantage plans that will provide dental checkups and some basics and x-rays and cleanings and that sort of thing as part of the basic benefit and with no or low copays. So, there are changes in the system, but once you enhance the services that patients can get, then that opens the doors for the types of fraud. And then the generative AI provides a lot of that backup information. If, we had issues with certain ethnic groups or groups that speak a specific language, Russians, Koreans, or whatever. The fraud perpetrators were often members of that same community, and they're sort of preying on their own. Now with generative AI, you can have people who speak Korean who are reaching out and defrauding Samoans because they've got the electronics, shall we say, to change the language that they're speaking into another voice in another language.
Right.
So,
Well, it's interesting, and I say this all the time on our OIG Roundtable podcasts and blogs, that the circus never changes. It's just the clowns in the circus rotate. And, the fraud schemes of today are the same fraud schemes of 20, 30 years ago. They just find a new way to do it. You're talking about ambulance. We have a client here at Advise. We do very, very niche ambulance reviews where they're upcoded claims. Non-emergent, unscheduled, where the doctor in the nursing home says this patient's CBC level is elevated. I need to have them evaluated in the emergency room. Is that an emergency? No, it is a unscheduled, non-emergent transport to the emergency department, but it gets upcoded as an emergency call because they're taking the patient to the ER. We're seeing that happen more and more. So a lot of these things that you're talking about, and particularly in the mail order space, DME, pharmacy. And the problem, unfortunately, is that a lot of times the onus is on the beneficiary to cancel that item or that product. We see that with diabetic testing supplies. That was a huge area. CPAP, incontinent supplies. You know, just this past year, we had that one case, 7 companies, $2 billion. You know, the one company that was doing $50,000 a year in wigs for cancer patients is suddenly spiking, right? Like, where is this all? But you see these things kind of recycle themselves. And so the best thing that investigators can do is to collaborate and understand what these schemes are and how are they going to recycle themselves. And I know we'll kind of leave it with this is the one thing I know you attend the there's a healthcare fraud task force meeting that HHS-OIG and the FBI put together, and it is done a couple of times a year. It's kind of a generalized meeting where a few hundred people go. We go on behalf of our New York City Medicaid clients. We did a similar one when I was in New Jersey at the U.S. Attorney's Office in conjunction with the FBI. The former chief of the healthcare unit set that up, and we did it. And it was a great way to do a couple of things. One, it helps you learn what schemes are out there if you're not aware of them, become educated. But the biggest thing is networking and collaboration and figuring out who the right people are to speak to at the right time. You know, one of the greatest pieces of advice that I got from Jason when I first started was you can't know everything, but you should have a really good Rolodex of people, because it's not about what you know, it's who you can call on to get those answers. So as we wrap up, I want you to kind of give us all the contact information. Where can people go to sign up for the newsletters? Where can people go to reach out to their local Senior Medicare Patrol? How do people get in touch with the Senior Medicare Patrol, either nationally or locally?
Right. And New York statewide Senior Action Council, which oversees our Senior Medicare Patrol and the SHIP program, the state health insurance program. Our number for the whole state is 800-333-4374. And if you get that number, they will give you the number for any other state. Okay. They'll give,
That's awesome. And I'm just putting up on the screen here for everybody to see. This is the SMP website. So it's, you know, smpresource.org, one word, smpresource.org. And you can get everything that you need right on that website. They will help schedule on-site visits, virtual visits, all of that stuff, so that people can become more educated about this. Tell me what you think as we kind of final thoughts. What is the biggest challenge that you see as an SMP volunteer? What is the biggest challenge that you see seniors being faced with when it comes to navigating their healthcare in retirement?
When a senior has a medical situation, either an existing condition or something new, it's getting the care. Number one is just getting the actual care, finding the provider, getting an appointment. You know, it's like if it's non-emergency, but you need to see somebody and you call and you know, let's say today is June 1st and they say the first available appointment is August 15th, that's daunting. Okay. And especially if there's a language barrier, if there's a disability, if there's a transport issue, just getting to the provider. Once the services are actually engaged, then it's also payment for those services. The coding that's billed to the program on their behalf. What are their co-pays? What are their bills? What are the follow-up steps? Is there durable medical equipment needed, a hospital bed, crutches, you know, something, you know, you fall on the sidewalk and you break your kneecap. Well, you got to have crutches, you got to have a you know, brace, all of that stuff. You might even need, you know, some time in a nursing facility. You know, it's all of the add-on types of things. And, you know, all of the bills for them, keeping track of them, between Medicare and your supplemental. And then when you're actually confronted with bills, dealing with them, because, there are some situations where there are, language barriers, um, economic situations. It's just a lot of pressure, and it's really tough on seniors, especially if there's a language difference, cultural difference, with them to actually process the information and stay calm about it. Especially when you've got a medical condition that, if you've got high blood pressure and then you've got to deal with bills coming in that you don't know what to do with and you don't know who to call, we're just exacerbating the situation. So, it's like getting the numbers to call, getting someone to get you from point A to point B. If they call the regional office, if they call 1-800-Medicare, if they call the Senior Medicare Patrol, just reaching out, even to the state Medicaid agencies or the local Medicaid offices. Please just call 1-800-Medicare if you've got a billing problem. If they don't have the answer, they know who to send it to.
Right. And the one thing that I always appreciated about the Senior Medicare Patrol was you really could call them with any question involving your benefits or bills, and they may not have the answer, but the one thing that they always do have is a great Rolodex of how to put you in touch with someone, even if it's for something as simple as, although it's complicated, but even something as simple as being able to have somebody help walk you through the bill and explain the bill and explain why this is covered, why this is not covered. All of these questions that people that may be, an older Medicare beneficiary who some cognitive issues may exist or just never had to deal with these issues until later in life. So the SMP really does work as an amazing backstop that unfortunately becomes the best kept secret that everybody should know about, because I think that there are a lot of people who don't really know what the Senior Medicare Patrol is to the extent that people could know or should know. So, and I think that as you get further and further out of the epicenter of a city, then it becomes more and more of a challenge because you do have these healthcare deserts where access to care and quality care may not be as abundant, and people at Senior Medicare Patrol chapters can kind of help with navigating that. So it's great to know that there are a lot of people who are willing to give of their time and effort to do this. Not everybody is a 40 plus year veteran of the Medicare program like you, but it takes a village, right? So there's a lot of people that are there that can go to you and have different skill sets than you, where you can go back and forth. And it's what makes the Senior Medicare Patrol such a unique organization, because it is built on the backs of volunteers, most of which are also seniors themselves. So you're really talking about a peer-run organization.
Very much so. And I hope that the federal funding for the SHIP volunteers and, for just basic Medicare and Medicaid counseling on what the services are will continue, as well as the Senior Medicare Patrol in helping seniors and caregivers navigate when there's something questionable going on, whether it's legit or whether it's potential fraud. Yeah.
Yep, exactly. Well, as always, Jean, it's always good to see you. It's more fun when I get to see you in person, but it's always good to see you on these as well. I always say you're like the national treasure for healthcare fraud, and there's a lot of truth. You've forgotten more than most people know, and you continue to be a great resource and a great steward of what the Medicare program is. So I'm always appreciative to have you on our LinkedIn Lives and share this knowledge and these experiences. So as always, it's great having you, and to everybody that's taken time out of their day to sit and listen to us chat for a little bit. We appreciate you tuning in. As always, you can get our LinkedIn Live recordings after the fact on Spotify, on our YouTube channel, through our website, advisehealth.com. And as always, you can also get our weekly newsletter by signing up through our website, get it right to your inbox Our weekly OIG roundtables are always available on those networks as well. And until the next time we see everybody on LinkedIn Live, have a good one. And Gene, it's always good seeing you. And we'll see you all on the next LinkedIn Live. Thanks so much for attending.